Hello and welcome everyone to the Next Generation Revenue Cycle webinar today. You have joined today's webinar listening through your computer's speaker system by default. Just a few things as you log in. If you would like to call in using the phone, simply locate that audio pane on the right-hand screen and select Use Telephone. The dial-in information and access code will then be displayed. You also have the ability to ask questions, so we'll be taking all of those towards the end of the call and the webinar. Feel free to enter those through the chat pane on the right-hand side of your screen. We'll be beginning in about a minute or a minute and a half. We'll allow a few more folks to join us, and we'll be starting soon. Okay, everybody, let's get started. So thank you all again for joining today's presentation entitled Next Generation Revenue Cycle. Before we get started, I want to review a few housekeeping items and let you know how you can participate in today's session. You have joined today's webinar listening through your computer speaker system by default. This means if you can hear music through your computer, you'll also be able to hear the presentation. If you would like to call using the phone, just locate your audio pane on the right-hand side of your screen and select Use Telephone. At that point, the dial-in information and access code will be displayed. You also have the ability to ask questions using your questions pane. Simply type in your question and click Send. At the end of the presentation, we will do a Q&A session and take as many questions as we have time for. So without further ado, let's get started. Welcome again to today's Jacobus Consulting webinar, Next Generation Revenue Cycle with San Juan Regional Medical Center. During this webinar, you will learn how to understand the foundations of building a successful patient-centric revenue cycle using a methodology that truly centers around individuals and their needs. Karen Miller of San Juan Regional Medical Center and Dave Boucher of Jacobus Consulting take you through the step-by-step process for engaging executives, clinicians, allied health professionals, and staff for achieving strategic organizational goals. Our guest speaker today is Karen Miller, Chief Financial Officer at San Juan Regional Medical Center. Karen has extensive experience in serving the financial needs of acute inpatient facilities, including Baptist Healthcare and Pikeville Medical Center. Prior to joining San Juan Medical Center, Karen held positions as Auditor, Director of Financial Planning, Decision Support, and Budgets, Consultant for Physician Compensation and Alignment, as well as CFO of Physician Enterprises. Our discussion today will be facilitated by Dave Boucher, Senior Managing Director of Finance and Revenue Cycle at Jacobus Consulting. With over 15 years of healthcare experience, Dave has held a variety of positions, including IT Systems Coordinator and Information System Director. While serving clients in consulting roles, Dave has managed front-end and financial implementations, CDM redesigns, conversions, upgrades, and process re-engineering. We're so glad to have you both today join us on our webinar. So now I'd like to hand it off to Dave to begin our presentation.
All right, thank you, Nona. Thank you, everyone, for joining us from across the country. I believe today we've got folks from as far away as Alaska all the way to the eastern seaboard. So some of the objectives that we want to focus on today is really catching everybody up on the middle of the movie. San Juan has been journeying towards a goal of revenue cycle integration and really a patient-centric focused revenue cycle. We're going to talk a little bit about where San Juan is in this journey, how they came to recognize that this journey was important. We'll talk about the critical role of analytics and the foundation that has played at San Juan. We're going to learn about the culture shift, how the organization is shifting the needle from a reactionary revenue cycle to a proactive management of that. We're going to understand the critical success factors that San Juan has adopted for what the expectation is of a lifelong and sustainable patient-centered revenue cycle. So we are in the middle of the movie. I'm sitting next to Karen today on site here at San Juan. Karen, it's a real pleasure to be here with you today. Thank you for being with us. And can you kind of get started, let everybody know a little bit about San Juan in the background here?
Sure, Dave. And I'm glad to be sitting here next to you as well. San Juan Regional Medical Center, we're proud to call Farmington, New Mexico home. We serve the entire Four Corners region of the United States. We are a 194-bed, full-service, level 3 trauma facility. We also serve our community with an integrated network of physician specialties. Our mission and vision is to personalize health care for our community with publicly recognized quality, which enables us to heal with vitality. That foundation has allowed us to be recognized nationally in the top 5% for overall clinical excellence and be recognized with numerous health grade awards.
That's excellent. Quality clinical care. Certainly one of the most singular and critical elements of healthcare today. But the affordability and sustainability of that clinical continuum relies, of course, on a healthy bottom line. And really being proactive in your revenue cycle. It's been a journey so far. We're going to talk a lot about this journey today, and I should warn everybody, since Karen and I are next to each other, we may laugh, we may actually cause each other to giggle a little bit, but as we talk about this journey, Karen, can you tell us a little bit about what the revenue cycle looked like 6 to 8 months ago here at San Juan?
Honestly, Dave, our revenue cycle needed help. However, we had great bones to work with. Our people within the revenue cycle are passionate and committed owners with a desire for excellence and a desire to do what's right for San Juan Regional and for our patients. We identified a couple of critical positions which were not part of our organizational chart, namely a CDM coordinator and a reimbursement management director. More pointedly, at its core, our revenue cycle was not patient-centric or proactive, and it certainly wasn't fully integrated or hardwired within our organization. We were unable to proactively manage our outcomes, and frankly, we spent most of our days fighting fires. We were largely in a position of not knowing what we didn't know. We were also unsure of how to mobilize our efforts to effectively collaborate. We had not integrated case management or revenue integrity into the revenue cycle team, and we lacked governance and had no visibility or consensus on our KPIs. Organizationally, we had a general lack of awareness of what was at stake. Overall, with all that being said, we did do a pretty good job of collecting cash, but we knew we could do so much better.
So the foundation of the people, kudos to the people that are here. I've gotten to know some of them over the last several months, and I agree they are absolutely fantastic. So you have this kind of current state that you're facing, and really, largely speaking, you didn't know what you didn't know. Have you recognized some challenges that you knew San Juan faced?
Beyond the lack of visibility to data, we knew we had a general lack of accountability, a lack of process consistency, and a lack of structure. We also had no feedback loop or mechanism for root cause problem solving. So we solve the same problem over and over and over. Largely speaking, we spent most of the time fixing and correcting bills and not nearly enough time working through collections or denials management. We had a paralyzing general lack of core infrastructure knowledge. Instead of having a system work for us, we created disparate and labor-intensive system workarounds. We needed the infrastructure to support our processes, and we were willing to make those changes to recognize the value of optimization and, where possible, standardize. And of course, we at San Juan Regional, like most organizations in the country, we're facing decreasing reimbursement trends along with a push to decrease expenses and increase revenue. It's that same song and dance, do more with less.
Yeah, so definitely great, no shortage list of things to do. At this point, we're going to take a quick poll of the audience and kind of get an understanding of what revenue cycle looks like for some of our attendees out there. So the question here is, what challenges do you have at your organization? I think it's important to note that you can check multiple boxes here. A lack of accountability and standardization, lack of collaboration, feedback. I call it that push-pull mechanism of communication, being able to push communication down, but being able to hear from the line staff of if things are working. And that lack of focus on collections, denials management, that lack of HCIS knowledge, whether you're Epic, Meditech, CERM, McKesson, it really doesn't matter. The system should be working for you. And of course, that visibility to key performance indicators. When we talk about KPIs, we talk about the fact that they are the most important and critical element is that they're trusted. It doesn't matter what system they're coming from or how they look, it's do we trust them. So take a little second here to finish this poll. Oh, we got instant results. Look at that. Very cool. Smorgasbord of answers. Accountability and standardization. I think we still have lots of opportunities here at San Juan in areas that are decentralized to look at how do we standardize them. Very interesting. Thank you, Mona. Okay, so moving on here, that do more with less paradigm that you mentioned. I'm very familiar with that. It doesn't matter if you're a university system or your critical access hospitals. We talk about that ye wear many hats mantra. The smaller an organization, the more hats you have to wear. The outcomes are the same and the expectations are the same. So at San Juan, we're obviously wearing a lot of hats. There's some pivotal roles that are missing, but you clearly had executive oversight here and sponsorship and awareness across the organization. Your colleagues, your leaders, they recognize that there's opportunities and really a journey for revenue cycle improvement. So you understood a little bit about your current state. What goals did you establish for yourselves as an organization as you developed your plan?
Well, Dave, defining the goals was the easy part. Achieving the goals, obviously, is far more complex. At the beginning, we identified a fairly lengthy hit list of objectives that we wanted to accomplish. A few of those, we wanted to define and establish a fully integrated revenue cycle. We needed to define a reimbursement management structure which would allow us to manage our payers, including monitoring contract obligations for remittances and establishing full visibility to underpayment analytics. We needed to develop accountability and transparency mechanisms for the revenue cycle by identifying and establishing those KPIs that matter the most, and then build from there. We needed to enable the underlying technology to work for us, not against us. We had to be able to leverage the power of that investment, learn from it, and as needed, adapt our processes to effectively use this technology for workflow automation, elimination of manual processes, and utilization of work lists. Some other objectives that I recall, we also needed to identify and solve inconsistencies in processes and standardize where possible. That was a key objective of this initiative. And finally, we wanted to automate billing, increase our clean claim percentage rate, and focus more time and attention on collections and establishing root cause denial management programs.
Okay, so the list is getting longer. It's a tall order for sure. No shortage of things to do, and you know it is a as we've said several times now, it's a journey. So as you identify these core goals and you had your executive support around you to begin this, what was your next step?
Well, Dave, we knew we needed help. The challenge was how to get where we knew we needed to get to. After calling a few colleagues and doing some research, we ended up selecting Jacobus to partner with and help guide us on this journey. Jacobus, the selection was predicated on Jacobus being recognized as a top-rated class firm that also has in-depth revenue cycle acumen, who is also able to harness our underlying technology without the need for yet another third-party system. We adopted the Jacobus pillars of the revenue cycle methodology, which is a game-changing approach to a fully integrated, patient-centric revenue cycle. And it all started with education, as you know.
Yes, I got to be a part of that, and it was quite an honor. The education. So you see these pillars of revenue cycle here in front of you. We had the opportunity to really reset revenue cycle, really reset the expectations with a moment of amnesty for your entire organization. And in front of you, you have the pillars. And this model of patient-centric cycle is really the roof of those pillars. And it calls out the idea of revenue and reimbursement that keeps the wheels on the bus. And it brings everybody together from the primary care, specialty care setting to patient access, regardless of whether it's decentralized or centralized. It bridges into the world of clinical care through case management and utilization review. It holds revenue integrity, really that idea of charge capture, into a whole new perspective. The CDM is not just a database, it's an active management tool in the organization to have gross charge accountability. Of course, health information management, patient financial services, and that continuing cycle of care coordination. This really is about population health management, as you know, one of the more familiar new buzzwords going on in the industry. The underlying focus, or the underlying foundation, of course, is a good finance and quality compliance team and information technology. So this methodology, we got to actually spend a day with the entire leadership at San Juan going through this in what we call a workshop. We brought all the leaders in the organization. We even had housekeeping and engineering in the room. Your marketing team was a part of it. And we were able to really reaffirm each individual role in revenue cycle. You talked about great people. Everybody in this organization knows their jobs very well. What was interesting was that they didn't necessarily know how the jobs of their colleagues intersected their processes and how it all came together really to achieve the same outcomes. So as we looked at adopting the pillars of revenue cycle, we really understood what's at stake. And this education was critical. So we came to the table. Everybody was able to learn from history. Folks had been here, I think we did a little poll, it was somewhere around 400 years of service to San Juan amongst all the leadership. And that brings with it a lot of history, a lot of different systems and process changes. And we were able to learn from that history, not dwell on it. And really gain buy-in that we're here to provide exemplary clinical care and outcomes with financial stewardship for our patients and community. We got to learn from each other in our roles, again, that baton pass, and I saw a lot of eyes opening in that. It was really, really beautiful to see people really understand how important each other's jobs were. We were able to chart the course on 3 vital elements to revenue cycle. The people, again, that kind of core foundation of success, how all the interconnected processes work with the various people, and then how that underlying technology helps drive us towards the outcomes that we expect. We got to better understand analytics. Again, regardless of how data is staged, it doesn't matter how pretty it is, what bolt-on system we're using, or not, if we're getting it right from the core system. It's all about trusting it, being able to define it, trust it, set variances, and be able to proactively manage yourselves according to those variances. And the entire organization got to learn about that exercise. We get to do a breakout session where we actually developed a plan. Each area of revenue cycle was able to walk away with an individual action plan and then integrate it in with the rest of the team. And then to kind of make sure that the drumbeat of revenue cycle wouldn't leave the organization, we were able to redeploy and restructure a revenue cycle team with a newly embraced vision. So let's take a look at that vision. I think it's really important to see what the commitment was of the organization as we walked away. This is a bit wordy, but we sat down and we agreed that it was about strategizing, designing, building, and implementing, and supporting the foundational elements of San Juan's fully integrated patient-centric revenue cycle. This includes the people, the processes, and the systems to streamline the workflow, improve performance, provide for knowledge management and ongoing training in order to ultimately reduce bad debt, realize our expected cash reimbursement, increase our revenue, and improve the patient experience through superior customer service and care funding while remaining compliant and transparent. This is a front-end vision that is really the core of revenue cycle now at San Juan, and something that all the staff have bought into and really really now begun to believe in every day as they're working through sometimes very difficult decisions and very difficult process reengineering discussions. So this workshop was a wonderful success. We established this vision. We walked away with a plan. So now let's take a quick poll to the audience again. And we're going to ask you all, do you think you have a patient-centric revenue cycle at your organization? And really that patient-centric focus is always asking yourself, are we doing what is best for the patients and the community? Sometimes that makes for very hard decisions. It can make for difficult times of changing a process to adapt to a system. And sometimes shifting people in the right roles to be successful for the patient outcomes. So yes, no, hybrid, not sure. Give you guys a couple more seconds here to answer the poll, and Mona will splash up our results. Very good. 25% feel we have a patient-centric revenue cycle. That's fantastic. Hybrid. I would be on a hybrid approach. Talking about where is your ambulatory world, your clinicians, health and specialty world, are they involved? Probably indicative of a hybrid model. Okay, Karen. So the revenue cycle was launched. This powerful moment of education was ingrained into the organization. And now you're beginning your journey. Again, this is about 6 months ago. As you begin that journey, can you tell us about some of the critical success factors that you knew were critical to be successful?
Well, adopting an integrated patient-centric revenue cycle pillar approach, it's so important to remember the underlying critical success factors. And there are 10 of them. There's a splash screen or a slide up there, and we'll kind of walk through each one of those. Governance was key, having total executive support. Many of you may have the same experience as I did. Revenue cycle was perceived prior to this launch as the CFO's problem, or the patient financial services or business office problem. So having that total executive support and an understanding within that group that revenue cycle is everybody's responsibility was key. Structure and workforce assignments, having the right people in the right jobs. Again, we identified 2 critical positions that were absent from our organizational chart through this activity. Workforce skills and knowledge, education. I can't speak to that enough. We had at San Juan Regional had lost some of that system knowledge over the years, and so that education was critical. Collaboration and communication. We found ourselves in such a siloed environment. By visioning the revenue cycle committee and establishing cross-pillar meetings, we're able to continue that, as Dave referred to it, that baton passing between the links in the revenue cycle. Processes, mapping and standardizing the processes to achieve the outcomes that we desired. Optimizing our core technological investments was crucial. Monitoring and controlling, elevating that accountability and establishing goals around the revenue cycle. Partners in care, I touched on this before, but revenue cycle is everyone's responsibility. So coming at this from a true organizational partnership perspective was key as well. Setting and establishing those financial performance metrics and building trust in those numbers. We had a lot of distrust of the information that was coming out of our system. So revalidation on our end and then communicating and getting that buy-in from our stakeholders was very important for us. And then customer service. It is all about the patients after all.
It really is. I talk about the Motel 6 analogy. I'd rather go, stay at a high-class Hilton versus a Motel 6, and really that should be the patient experience as it relates to revenue cycle in any healthcare model. Okay, we've got critical success factors. You've established your goals. We've level set education for the entire organization. And now we've walked away with a whole list of priorities and objectives that need to be accomplished. It can be so overwhelming. There's, in our professional world and even personal world, we set goals. We typically set small goals so we can be successful. Having so many priorities to think about, even just the top 3 across each pillar, gives us some 15 to 20 primary objectives. There might be some low-hanging fruit in there, but some of them, may be difficult projects. Like, for example, medical necessity. That's not something that you can solve overnight. So we knew we had to be careful working with you, Karen, to not set ourselves up for failure. So we had to prioritize. We relied on you and the executives to help us with that prioritization, and we knew that the myth in the organization that the business office was the revenue cycle had been stymied. That education had been laid. But we knew that the business office or patient financial services was where we needed to start. That is really the area where there's so many symptoms that present themselves for the broken revenue cycle. So we started there in a full cross-pillar awareness and collaboration. And right after that began, we went through and began work in the revenue integrity and charge capture arenas and the reimbursement management, contract management initiatives. So we've got this big elephant that's in the room. So Karen, now what? What's the next steps now that we've started these first 3 areas?
Well, Dave, it started first with the strategy. Then we set about articulating the key performance indicators so we could effectively manage our current state and understand the goals. Then the process reengineering occurred, in which we mapped out the current state of all of our processes, identified gaps, and worked toward understanding what the future would look like. There were many decisions to be made as we began working toward the optimization of our core technology and providing the appropriate level of training and education to our staff so that we could empower and enable them to deliver the targeted outcomes that we desired and to be accountable to achieving those outcomes.
All right, so that integration of strategy, the process reengineering, enabling that technology to work for you, not against you, and giving the right people the right tools to meet those objectives. Really well articulated. So this is a marathon. This is a slow race that we run to achieve this, and obviously this became a phased approach for success. So with that idea of a phased approach and the fact that we're really, again, in the middle of the movie here, what type of timelines did you have in the first 6 months?
Well, Dave, it really is that old story of how do you eat an elephant, and you eat it in small bites. So using that analogy, we're eating this elephant in roughly 6-month increments. One of the things we recognized early on was that this was not going to happen overnight, and we did not want to set ourselves up for failure by setting unrealistic expectations or targets. A journey towards revenue cycle excellence can take a year or more in order to implement the model and begin seeing those sustained results. So we're in the middle of our journey now, but as you know, every part of the revenue cycle within SJRMC is ultimately in scope.
So here's a good image up here that kind of dialogues this journey, where the workshop really began and some of the structure, the foundational elements. We couldn't just dive into the CBO or into PFS and begin without the executive team being engaged, the full integration of stakeholders, and that cross-pillar collaboration happening. And there were some key assessments that took place to understand what are the priorities and to begin the actual optimization of those areas and the standardization. Okay, so we're 6 months in. We see the timelines here. We're right at the beginning of March, just wrapped up the first phase. Towards this journey of an integrated patient-centric revenue cycle, Karen, what are some of the early accomplishments that San Juan has realized so far?
As a CFO, you would expect that I would land first on the hard winnings from this engagement, but truthfully, the recognition, commitment, and engagement to the revenue cycle initiative has been incredible. Our talented team members had strong appetites to deliver excellence, and as they've been given the tools, knowledge, and processes to make substantial improvements, they have truly excelled. A few examples, bottom line, cash. Cash is king. We are trending well above our cash goals. These trends we expect to continue as we are just now beginning to realize the ROI of this first phase of the engagement, so we're so excited about this. We've achieved significant clinical buy-in and recognition of the importance of revenue integrity. Our organization has begun to recognize revenue integrity as a chain of interdependent processes that require precise documentation, well-built and managed clinical systems, integrated coding teams, and a constant feedback loop for denials and charge capture issues. That statement right there, I can't emphasize enough. That feedback loop, our physicians, our care delivery providers had been very anxious for that information, and we're finally able to start providing them that information that allows them to excel and to trust in our revenue cycle processes. Ultimately, our global late charge percentages are continuing to fall. We are right around the 3% range, and our gross revenue accountability has been deployed and embraced across the organization. With reimbursement management, we've implemented our core infrastructure functionality, which allows us to properly calculate the contractual adjustments and expected reimbursements. That allows us to proactively manage our payments and to track and trend those underpayment analytics that had been absent. One significant early win was about $1 million issue that was identified with one of our payers, in which the payer had been reimbursing us under the wrong weight table. That was a huge win for us. With both revenue integrity and reimbursement management, we've laid the groundwork and structure to establish those daily, weekly, and monthly accountability metrics and tools to keep these critical areas of the revenue cycle on track. And we finally gained trusted visibility to our top denials, again, part of that feedback loop. In patient financial services, we've focused on core functional areas of the system and processes with an ultimate goal of increasing our clean claim percentages, reducing manual billing, and redeploying those resources devoted to billing activities now and redeploy those to collections and denials management. In this effort, we've also learned that our existing clearinghouse was insufficient, and we have begun the process to implement a new tool.
All right, what a journey. Let's Let's talk a little bit about some of the KPIs as well. Mona, if you can click over to the next slide here. There's a couple of dashboard examples of some of the early data that we established. 6 months ago, this was not visible data. I mean, it existed in bits and pockets in your system, but it wasn't talked about at the revenue cycle level. I got to witness your revenue cycle team owning this earlier today and staging this data, talking about it, and going through a proactive management of worrying about the trends that are going on and having a call to action to actually go out and solve some of these problems. And you can see some of the cash management trends that Karen referenced. Cash is above par. Denials management. This is a bit of a scary story. This data was not visible 6 months ago. It is now visible. And this is indicative of a lot of the front end and mid-cycle issues that are going on and really going to be part of the focus of phase 2, which we'll talk about in just a second. Now you see the late charges trending down, percent of volume, best practice being under 3%, and that trend is beginning to happen. There is about 17 or so other real critical KPIs that have been established, and I want to just say again that it didn't matter what this really looked like or smelled like. It all mattered that you trusted the data and that it was defined and that you knew where the detail behind this was so that you could actually make very good decisions behind this data. It truly is about the analytics, and revenue cycle is a beautiful thing. I joke with the clinical part of our company that it doesn't matter how bad I do, I can never kill somebody, but I can certainly make the numbers worse or better. So Karen, the journey is clearly not over, and you have another phase you're getting ready to go into. Can you tell us a little bit about that?
Yeah, absolutely. We are fully committed to this project, and we know that we've only just begun. Following the implementation of a clearinghouse, which is a key milestone and part of the project, we will, following that new clearinghouse implementation, we'll begin to ensure that the processes and system optimization components of patient financial services remain sustainable. We'll continue our cross-pillar collaboration efforts and begin to focus on other root cause optimization efforts across the other pillars of the revenue cycle.
Well, so this phase 2 is beginning, and the journey continues. But the industry is going to continue to throw us curveballs. Healthcare is changing rapidly, and be it at the local level, the state level, and even the national level, it is an election year. A lot of unknowns of what's going to happen. So, Karen, how do you think the organization has prepared itself to evolve and adapt as the industry changes?
Well, to kind of step back a little bit, and this is a quote I'd heard years ago when I started my healthcare career, and some of you may know this, Sister Irene Cross of the Daughters of Charity Health System, one of her famous quotes was, "No margin, no mission." And with our patients in the forefront of our mind, we must maintain our margins. So we are highly motivated to continue on this journey, and it all starts with analytics. We can't manage what we don't measure. So as Dave indicated, we've identified approximately 20 KPIs that have paved the way for our proactive management of the revenue cycle. We'll continue to add to those KPIs in a methodical approach and integrate our network of physician practices in a future phase. As billing and collection processes become automated, a significant next step is to focus on that root cause denials management. This root cause approach allows us to understand the who, what, when, and how around denials and allows us to work towards mitigation.
So root cause denials management, automation of billing, and improved collection really to maintain that bottom line and to have the analytics help you prepare for some of the changes that are coming around the industry. Really, really fantastic. So we have another quick poll here that we wanted to wrap up with. So denials management is a very scary topic. It requires really a lot of foundational prerequisite items to establish before we can really get to a trusted program. So you can select more than one here. You know, what best describes your approach? we don't worry about it, but we should, or maybe we don't have visibility to it, but we should. We work denials mostly in PFS and what I would call kind of a retroactive manner. HIM and case management might help us work denials, i.e. clinical appeals. And really where we want to go is that root cause denials management prevention. Being able to educate the clinicians, understand where the denial happened, who is involved in the care of that patient, and learning from the payer trends so that we can actually prevent that denial from happening again in the future. We're going to do a couple seconds here to answer that poll, and Mona will splash that up for us. Karen, while folks are answering this, I again wanted to thank you very much for the opportunity to sit next to you today and tell this story and to educate people out there on your journey. You're not in this alone. This is certainly something that I think colleagues around the country are sharing. People are in different stages of their journey, but it's really powerful that you're able to come up and tell your story. And I really look forward to coming back in maybe another 9 months to share with those that are interested on where you've come in this next phase. I think really getting after those denials and working with the patient access and HIM teams. This is a decentralized environment, so there will be lots of complications there, and we'll get to share that side of the story here maybe in quarter 4. So with that, here's some of the results of this denials question. Denials are worked mostly in PFS. That does not surprise me. That really is something that I call kind of a plague in our industry. We just try to fix it and get it out the door and get our cash in. But we're not learning from the denials and adapting our processes or trying to educate our teams to prevent them from happening again. So with that said, Mona, I'll turn it back over to you and for any questions that might be out there. Thank you.
Great. Wow. Thank you so much, Karen and Dave. Excellent metrics towards the end, and we are so excited to see where you guys take this next into phase 2. So right now, we're going to go ahead and take the audience questions. Just as a reminder to everyone listening, if you navigate to the chat pane on your GoToWebinar screen, you can actually type your question directly into the chat box, and then we will open that up for questioning to Karen and Dave. So let me begin with the first one. Karen, it looks like this one might be for you. Can you describe any major decisions you have had to make during the project?
Well, Mona, we make numerous decisions every day. Part of the process is empowering our team to make those decisions, as well as putting change management processes and putting a process in place to document, track, and communicate those decisions as they're made. But off the top of my head, obviously, one key decision that we've worked on as a team recently has been identification and selection of a replacement clearinghouse, sorry, my mind's gone, clearinghouse tool for our hospital to position us to move to this next phase of the project.
Excellent, thank you. Looks like there's another one in here. The next question is for you, Karen. What is your...
For you? That's not fair.
Give Dave some questions.
I know. It's all about Karen right now. What is your expected ROI?
I do like that. I won't lie. I do like it all being about Karen.
Excellent. So the next question is, what is your expected ROI?
You know, we're early in the engagement. We have some numbers. I kind of hasten to throw those out. But, you know, leave no charge behind is a key objective. We want 100% charge capture. We obviously want and need to maximize our reimbursement. Transparency and accountability around the revenue cycle process is something that our stakeholders are asking for, looking for, and expecting. So building that transparency and accountability is a key deliverable of this project. And then, you know, as Dave mentioned, that root cause denials management system is, one of those deliverables that we're keen on realizing. The actual numbers we do on a weekly basis at our Revenue Cycle Committee team meeting, we do go through what we refer to as a WAR report.
Where we're looking at the specific wins, both process wins, automation wins, and really what of those kind of soft wins, what turns around into actual cash in the organization. Yeah. Both actual and predictive, really using some measures of predictive analytics on what wins will trend and be sustainable over time. So it's a significant ROI. That happens in these. This is no shortage of a big investment for an organization, regardless of partnering. This is a critical time investment. It changes the culture and how you think. We were kind of joking this morning. There's a self-inflicted pain that goes on. What's today? Tuesday. Where at about 6:45 in the morning, all of the revenue cycle leadership is gathering outside the finance building to be let in, where we begin the day with a revenue cycle committee meeting. And I laughed. I said, guys, this is painful. It's so early. But we're committed, and this is the only time we can all get together, and we're here, and off they went. And it was a great session.
Yeah, and I will add to that. What's kind of interesting, just the engagement, the commitment of the team to this activity and to the end results. When people who have submitted their PTO time requests still show up for the 6:45 in the morning revenue cycle meeting, you've really tapped into that desire for excellence.
Or we're carrying a big stick, one or the other.
Or we're carrying a big stick.
No, but it's true. It's all about they are dedicated and passionate.
Yeah.
It sounds like your team is dedicated, and it's a commendable achievement that they're all getting up that early, Karen. It's great to hear. Another question coming from our audience members here is, how would you describe the ideal revenue cycle leadership organizational chart?
Well, I don't know, and Dave, you can jump in. I don't know that we have some, I guess, anomalies in our organization structure. Currently, HIM reports to our CMO. You may, in some other organizations, HIM, typically reports to finance. I haven't really seen that the organization structure is such the underlying driver, so much as breaking down those silos and creating those cross-pillar meetings and opening up that communication. I don't think it really matters that much where you report when the whole executive team is bought into this engagement. So it's not you're HIM and you report to me, so therefore you're going to accomplish this. This is an organization-wide initiative, and everyone, the entire senior leadership team is bought into the end result and holding their team members accountable.
Yeah, I think that's very well said. Really, from an HR perspective, it doesn't matter. This is a health system problem, not an HR issue. And I think in this journey, we talked very little about the actual org chart of revenue cycle. Because it's been an executive-sponsored endeavor, it has been about getting the right people in the right discussions and elevating that transparency and accountability. And so there is an org chart as it relates to the revenue cycle committee structure and the cross-pillar structures, and really it correlates back to those pillars, having every executive that is over top of those pillar roles or those departments, and having all of the department leadership at the table. Of course, having revenue owners in the organization at the table as well when it relates to revenue integrity. And then I think, like you said earlier, Karen, you had identified some holes of key staff, key directors that were not a part of the org chart before, like CDM coordinator and reimbursement management coordinator, that have now been approved and are a part of the system. So that was key, but but HR doesn't matter because right from your CEO down, this was a health system problem to solve.
Really great way to explain it, both Karen and Dave. Thank you so much. There are a couple of questions from the audience members. In fact, quite a few have popped in that are asking if it's possible to have access to the presentation slides. I'd just like to let everyone know that absolutely yes. You will all be receiving an email within the next day or two with an attachment of the PowerPoint slide deck or a link to the recording and the deck. So be looking out for that, and it'll also be on the jacobusconsulting.com website. In the meantime, there is another question that's come in here. So it sounds like it's more of a comment, which might be interesting for you all to respond to. There is need to create a central processing center with VPF as the head, with HIM, case management, physicians, and analytics as the main structure. Any response to that?
I think it's all about the temperature of the organization and really the where can you without totally restructuring things achieve those successes and outcomes that you need. Here at San Juan, there is a central business office. There is structure within that to delineate the ambulatory side versus the hospital side. And they're not on the main campus. So whereas HIM and case management, patient access, of course, is involved in the main part of the hospital. And kind of where those people are physically located, again, was reviewed at a very high level, but very quickly a moot point because that pushing and driving towards analytics and that underlying commitment across the totality of the organization to step forward and be a part of this and to meet at odd hours and to really roll up their sleeves and get dirty and to think critically and to help solve the problems. It didn't really matter where people were located, but certainly in larger organizations, if this was an organization that was multi-facilities across miles or across multiple states, I'm thinking of some of the things like Intermountain West has done out in Utah, Cleveland Clinic has done in Ohio. They've got organization structures throughout the United States. They have centralized and eliminated some of redundancy in processes in order to centralize some of that and to streamline really ultimately cost of getting the job done. But at San Juan, that really wasn't much of an issue. What I think will evolve is that as billing becomes more automated, the clearinghouse gets integrated into the core HCIS, there will be a recasting of roles potentially to really focus on collections and that area where there is not as critical the focus today, and that's denials management. That functionality and that core responsibility will happen potentially with the recasting of roles, but it's certainly that structure of where people live and are located is absolutely critical to think about in this, because it can quickly become a risk and a barrier to your success. It's a very good question.
Yeah.
Great. So I think we'll do one last question and then post a couple of things towards here at the end that are important for some upcoming save the dates. But the last question here is, Karen, for you, what kind of barriers did you face in terms of staffing? And in other words, was there resistance to staff buy-in?
As I mentioned, and I can't say it enough, the team of folks that I'm blessed to work with here at San Juan had such an appetite for getting to where we needed to be. They knew that that the education around our core HCIS was not where it needed to be. They knew that those workarounds were not the optimal state. So, very early on when we assembled our revenue cycle committee, we laid out basically what we refer to affectionately as an amnesty program. just show us your underbelly, pull out all the stuff that you're, that may not be functioning as well as it should be, or all those opportunities for process improvement. Let's lay them on the table. What was done in the past is in the past. Let's start anew from today and build those processes and get us where we need it to be. So I think laying out that expectation that people could speak freely and engage in lively debate and engage in decision making and feel, not have that fear of kind of retaliation or reprisal, or I'm going to look stupid because I didn't know to ask that or whatever. So that culture around an amnesty environment was essential for us.
Right, and we commend you really for creating that culture and really seeing the early successes already of such a true undertaking and transformation. So really thank you, Karen and Dave, both for a wonderful presentation. Just on this next slide here, we want everyone to know that we have a lot more webinars coming up in the coming months and over the course of the year. Some revolve around reimbursement management, the power of AR analytics, more results around the transformed revenue cycle. Our newest and most exciting topic really is the predictive analytics. What do I do with all this data? That's coming up on March 31st at 10 a.m. Pacific, and that will be, our speaker will be Dr. Clyde West. He's the adjunct professor at USC and the executive clinical strategist here at Jacobus Consulting. Very exciting information to be shared on that webinar, so be sure to register. Before we wrap up, I'd like to ask the audience to just take part in an exit survey, a really short 3-question survey, just to get your gauge on how today's webinar went and how the speakers did and where we can improve, and other topics that we can certainly present on for your benefit. Thank you everyone for joining us today. If you would like to, again, view the archive of this webinar on demand or share it with a colleague, please visit the webinar section on jacobusconsulting.com. It will be available in the next couple of days. We'll also be receiving an email shortly with the links to everything from today's webinar. So thanks again so much. Have a wonderful day, and we will see you very soon.